Okay, magandang umaga po sa lahat. Welcome to mandatory 8-hour OSH seminar for workers or employees. Okay, once again, Ferdinand Pascual, your Occupational Safety and Health Officer. Ako ulit yung magiging speaker nyo for today for the second module, Module 2, Understanding Occupational Safety and Health. Okay, yung first module was yung Introduction to OSH, and this is our second module. Yun nga, understanding occupational safety and health. Okay? Training house rules. Certificates of completion shall be given to participants with complete attendance for this mandatory OSH training modules for employees. Lahat ng mga attendees na makakakumpleto nitong modules na to ay mabibigyan ng Certificate of Completion. Okay? Start na tayo. General concepts on OSH. Okay, objective for this session. At the end of the session, the participants will be able to define and discuss the general concepts of OSH towards effective OSH implementation in the workplace. Okay? Sabi nga, at the end of the session, yung participants dapat alam na or kaya nang i-discuss yung implementation ng OSH management sa workplace. Okay? Okay, number 1, accident. Discuss natin no, ano ba talaga yung accident, paano ba ito maiiwasan, or even saan ba ito nagmula, or ano ba ang sanhi ng pagkakaroon ng aksidente. Discuss natin ito, okay? As defined, an occurrence or event that is expected or unforeseen, unplanned, and unwanted. Ito yung mga pangyayari, no, na hindi inaasahan, hindi pinlano, mangyari or even hindi natin kagustuhan na nagre-resulta sa losses or through damage to property, pwede ring injury or mas malala yung death. Okay? Common reasons bakit ba may mga nangyayaring aksidente. Ito yung sabi ng iba, no? Yung mga layman's term. Oras na kasi niya, hayaan na natin siyang mamahinga. Or malas naman niya, or ang tangi kasi niya, or even kasama sa trabaho yan. These are not real causes, no? Hindi ito yung mga totoong dahilan kung bakit nagkakaroon ng accidents. Okay? These are only excuses. Okay? Malaman natin. These are the common examples of accidents in the workplace, no? First picture, yung improper lifting. Yung pag nagbubuhat ka ng mabibigat na bagay in improper way, kakaroon ka ng back pain, no? Second, itong sa gawing kanan, pag minsan naglalagay tayo ng mga gamit sa maling lugar, no? Especially overhead. Nasa dulo, konting uga lang or konting galaw lang, mahuhulog. Minsan, malas, may martilyo or wrench na babagsak sa ulo mo. Also, in the use of equipment, tulad nito, electric saw, no? Unguarded yung equipment. So, pwedeng maputulan ng kamay yung gumagamit kung nagkamali siya, no? And also, this kind of spillage, pag nakita nyo yung ganitong symbol, it's hazardous materials, no? Pwedeng biological or chemical spills yan na pwedeng mag-result ng disease or illness. Okay? Another picture is itong parang mahuhulog na to. Nakatungtong siya sa isang box. Tas pwedeng nahulog siya, no? Kasi improper yung ginamit niyang tungtungan. This is dapat gumagamit siya ng ladder. And this one, yung nasagasaan ng pison, ito naman, nadulas siya dahil merong wet surface. May mga spills. Aring nadulas siya. Also, ito, electrocution sa mga electrical works natin. This one is pwedeng defective na yung chair or kung ano-anong posisyon yung ginagawa niyang sa pag-upo kaya nahulog siya. And this one here is yung mga scattered na electrical cords na pwedeng mag-cause ng trip. Okay? Trip incidents. Ito naman, nagtutulak siya ng trolley, maaaring nadapa siya or natalisod or nadulas. And also this one, gumagamit ng hagdan, pwedeng naglalaro siya or nakikipagharutan habang nasa hagdan at nag-cause ng aksidente pagkahulog sa hagdanan. No. Those are the common examples of accidents in the workplace, no, that may lead to injuries or even death, pati na rin yung mga losses like damage to properties. Okay, ito yon. Hindi totoo yung sinasabi kanina na mga excuses na ang malas naman niya, siguro panahon na niya, pabayaan na natin siyang mamatay. Hindi ganun yon. Siyempre, pag may aksidente, merong mga causes yon. Yun yung pag-aaralan natin ngayon. Okay? Sabi ko nga dun sa first module, ang focus of Osh ay sa people who are doing the job, materials na ginagamit, equipment, and environment. So, ito na yon. Sa mga people or yung mga employees, yan yung mga workforce, pwedeng from the management of the workforce, policies, behavior, yan yung mga causation ng accident from people or employees. Sa materials naman, kung anong materials yung ginamit or saan ba gawa yung materials, and for equipment, yung mga tools and equipment nga, yung mga machinery na ginagamit natin, and also the environment. This is the surroundings, no? Yung natural environment natin. Minsan community, social, and legal influences. Yun yung focus ng OSH. Okay. Accident causation refers to the factors that are primary reasons behind an accident. Ito yung totoong dahilan ng aksidente. Okay? Malinaw, no? Hindi dahil malas siya, hindi dahil time niya na, hindi dahil ang tangi niya, hindi ganon. Ito yung mga reasons. Ito yung mga primary reasons behind an accident. Okay? Ano ba ang epekto ng aksidente pagka nasa workplace tayo? Ito lang, simple illustration, no? Yung focus ng OSH like people, equipment, materials, and environment, pag pumalya yan or nagkaroon ng aksidente, anong mangyayari? May injured yung worker, di ba? May injured yung employee, and then anong magiging result? Hindi niya magagawa yung kanyang task. Di ba? Ibig sabihin, yung productivity natin ay nawawala or bumababa yung productivity level natin pag merong mga aksidente caused by these factors. Okay? Based on the domino theory, ang accidents ay 98% preventable and 2% non-preventable. So, mas mataas pala yung chances na maiiwasan natin magkaroon ng aksidente pag nabigyan lang natin ng tamang controls, ng mga preventive measures, no, bago mangyari ang aksidente. Only 2% is non-preventable. Siguro mga behavioral aspects na yan, no. Di-discuss natin. Under this 98% preventable, most of these are from unsafe or unhealthy acts. 88% galing sa unsafe acts, no? Another 10% is from unsafe conditions. So, taas ng porsyento, no? 88% pala dahil sa maling gawa or wrong practice ng trabaho kaya nagkakaroon ng aksidente. Okay? Ano ba yung unsafe or unhealthy act? Okay? Dalawa lang kasi yan eh. Unsafe act and unsafe condition. Okay? Discuss natin tong unsafe act. Okay? A human action that departs from a standard or written job procedure or common practice, safety rules, regulations, or instructions. Okay, pasimplihin lang natin yung definition ng unsafe act. Ano ba yung unsafe act? It is a violation of a commonly accepted safe procedures and or processes. Okay? Simple lang, pag di mo sinunod yung tamang pamamaraan kung paano gagawin yung trabaho mo or yung task, that's the reason kung bakit nagkakaroon ng aksidente. Okay? That's the unsafe or the unhealthy act. Ano bang titingnan natin sa as workers or as employees para ma-determine natin kung unsafe act ba or unhealthy act yung na-observe natin na kilos or movement ng ating mga coworkers. Okay? From unsafe acts, these are the common examples. No? Yung operating equipment without authority. Sabi ko nga, sa first module, ang example ko doon, yung mga incompetent personnel na trying to operate an equipment without proper authority. Ito, example nun. Unsafe act pala yun. Unsafe act, operating equipment without authority. So, meaning, pag hindi ikaw ang tamang tao or trained personnel to use the equipment, pag mong gagawin. Kasi isang cause na yan na pwedeng magkaroon ng accident. Okay, next. Removing safety devices. Okay? Yung mga ini-issue natin na safety devices or personal protective equipment, yung mga machine guard na yan, wag mong tatanggalin or wag mong hindi gagamitin. Okay? Kasi that will fall under unsafe act. Another accident cause na naman yan. Using defective equipment, yung mga sirang gamit, wag na natin gamitin yan. Pag sira yung equipment, i-report, i-request ng repair or replacement. Kasi it could be a factor na mag-contribute sa accident. Okay? Using improper or not using of PPE. Okay? Same with this one. And horseplaying. Ano ba yung horseplaying? Ito yung habang nasa trabaho or ginagawa yung trabaho ay naghaharutan. Yung isa nagiging factor din yan para magkaroon ng aksidente or accident. Okay? Ito yung mga examples ng unsafe acts. Okay, let's go to unhealthy acts. Dalawa kasi yan. Unsafe acts, okay, and then unhealthy acts. Okay. Number 1, smoking cigarettes in the workplace. Okay, that's unhealthy. Inhaling organic solvents, yung mga nagra-rugby, that's unhealthy. Drinking alcoholic beverages during office hours. Okay, especially this one, taking illegal drugs inside company premises. So that's how you define unhealthy acts and unsafe acts. Okay, this is one example no, ng unsafe act. Meron siyang nire-repair niya yung sasakyan. Using this piece of woods as brackets or brace ng sasakyan niya. Yun yung basic example ng unsafe act. Dapat, kung kailangan mo ng braces or pangtaas ng sasakyan para makapasok ka sa loob, gagamit ka ng tamang guard or sabihin na natin yung jack para mas matibay at sigurado yung pag-hold niya dun sa weight ng sasakyan. Kasi yung ganitong klase, yung kahoy, konting slip lang yan, konting dulas lang yan or matamaan ng kahit ano, magmumove na yan, babagsak na babagsak na sa yung sasakyan, maiipit ka, then mapupuruhan ka sa ulo, mababali ang buto mo, ayun na yung sinasabi nating injuries. Okay? Caused by accident. Caused by unsafe act. Okay? From unsafe acts or unhealthy acts, dito naman tayo sa unsafe or unhealthy conditions. Okay, ano ba to? The physical or chemical property of a material, machine, or the environment that may result in injury to a person, damage or destruction to property, and other losses. Okay? Could have been guarded or prevented. Okay. Ito na. Preventable pala tong unhealthy or and unsafe condition na to. Okay? Ano yung mga titingnan natin? For unsafe conditions, common examples, defective tools or equipment. Ito nga, baka sira na yung gamit mo, yung grinder, yung drill, or any equipment. Pag defective, huwag nang gamitin. Okay? Mataas na yung chance or mataas na yung probability na magkaroon ng aksidente pag defective ang mga tools or equipment. Number 2, congested or block exits. Okay? Yung mga tinutukoy dito yung mga emergency exit doors natin, dapat hindi siya obstructed, no? Kasi once na magkaroon ng emergency, especially sa fire, nagkaroon ng fire incident and nag-order ng evacuation, itong mga emergency exits na to yung ginagamit natin to evacuate or to descend the building, no? Yung lahat ng nasa loob, dun yan dadaan. Dapat hindi yan barado or walang nakaharang dyan, okay? Inadequate warning systems, okay? Slippery floors. Yung mga, minsan may mga tubig dahil sa tulo ng aircon, nakakadulas, no? Minsan may mga natapon na juice or natapon na tubig na hindi agad napupunasan, yung mga nagko-cause ng aksidente. And hazardous atmospheric condition. Minsan, for example, masyadong mausok, okay, masyadong mainit, and minsan naman, masyadong malamig. Okay, depende sa condition ng work environment mo. And then, unhealthy conditions naman, yung mga sobrang ingay or yung excessive noise, yung prolonged exposure sa maingay na lugar. Basic examples, yung gumagamit ng mga jackhammers, mostly sa construction projects. Yung mga nag-ooperate ng jackhammer, sila'y nakaka-experience nung sinasabing excessive noise, no? So, dapat ang operator ng jackhammer, as part of his protective equipment, dapat meron siyang at least earplugs or kahit earmuffs to reduce yung noise excessiveness, no? Para hindi siya masyadong maapektuhan ng ingay ng ginagamit niyang equipment. Okay, inadequate illumination or ventilation. Same with sa mga offices, no? Pag masyadong madilim, hindi mo rin magagawa ng maayos yung gusto mong gawin, no? And another factor para magkaroon ng aksidente. No? For example, madilim yung part ng table mo, tapos meron kang hinahanap na isang bagay, tapos kinakapa-kapa mo lang siya kasi madilim nga. And di mo alam, gunting na pala yung kinakapa mo or blade or needle. Yun, mga posibilidad na magkaroon na ng accident due to poor illumination. Okay? Extreme temperature. Sabi ko nga kanina yung sobrang init or sobrang lamig. Okay, another example ng this is a fire exit. Okay? Simple illustration lang na sabi nga kanina, all fire exit must be cleared from obstructions, no? Pero dito sa picture na to, mukhang hindi. Kasi may mga nakaharang na mga rocks, mga lumang gamit. Ayan. Paano pa natin siyang gagamitin for evacuation during emergencies, di ba? Mali yan. Kahit simpleng employee, kahit sino, basta worker sa building, basta na-observe mo na may obstructions from the emergency exits, report nyo na sa supervisors nyo or sa safety officer. Okay, another illustration here of unsafe act or unhealthy acts. Ito yung mga unaware, unable, unmotivated. Those are the factors for unsafe and unhealthy acts, no? Doon naman sa unsafe and unhealthy conditions, ayan yung mga hindi napansin or hindi nabigyan ng corrective measures. Okay, ganun lang kasimple yan. A fatal accident is just the tip of the iceberg. Ang lalim naman nito. Okay, dito sa picture, ito yung tubig, no? Ito yung iceberg. Ito yung nakikita natin. Minsan, nakikita natin yung aksidente na nag-result to fatal death. Sabihin na natin, pagkamatay, no? Pero beyond that, meron pang mga underlying occurrences ng aksidente. No? Bago mangyari itong isang single death na to, marami na yan. Meron ng 10 serious accidents, 100 minor injuries, 1,000 hazardous occurrences, and 10,000 unsafe or unhealthy acts and conditions. So, bago pala nagkaroon ng isang pangyayari na may death, okay, meron ng mga mas magaan na incidents na nangyari. So, meaning, kung dito pa lang pala sa ilalim ng iceberg na yan, is na-correct na natin tong mga unsafe and unhealthy acts and conditions, pwedeng na iwasan natin ang pagkakaroon ng death. Okay? Ganun lang yon. Simple as that. Kahit na magaan or basta unsafe condition, kailangan nating i-correct. As workers, you need to identify the unsafe or unhealthy acts and conditions in your workplace. Siyempre, sabi nga, safety is everyone's responsibility. Okay? Ganito yon. Kung hindi man kayo capable of doing the communication or the coordination pagdating dun sa observed unsafe and unhealthy acts or conditions, ganito gawin nyo, i-report nyo sa supervisor nyo or sa safety officer. Okay? Implement control measures to prevent accidents and illnesses. Yun nga, pag nag-lay ng guidelines ang Health and Safety Committee pertaining to your specific task, kailangan implement natin yon within our workforce. Okay? Tulong-tulong tayo kasi hindi pwedeng isa lang yung bubuhat doon sa lahat. Mas maganda, mas malakas kung lahat tayo magiging involved pag-implement ng mga control measures na ginagawa natin para maiwasan natin magkaroon ng aksidente at mga pagkakasakit. Review. Kaya na bang i-differentiate yung unsafe acts and conditions? Okay. Okay, take these keywords, no? Pag sinabing unsafe acts, ito yung mga pagkakamaling resulta ng paggawa or galing sa tao. Okay? Pag sinabing unsafe conditions, ito naman yung mga maling surroundings, maling environment, maling workplace, maling setup ng workplace kung saan nagkakaroon ng aksidente. Okay, yun lang yung difference. Unsafe acts, nagawa ng tao, safe conditions, ay galing sa work environment. Clear points. Accidents and injuries result to losses of lives, limbs, time, and property. Oo naman. Sabi nga, sa definition ng accidents, it can lead to losses, damage to property, loss of lives, yung limbs na yan, yung parts of the body, ang oras, okay? Most accidents at work could have been prevented. Palagi nating tatandaan yan. Pwede nating iwasan. 98% pwede nating iwasan ang pagkakaroon ng aksidente. Unsafe and unhealthy acts and conditions in the workplace. Lagi, it should be addressed. Pagka may report ng meron na observe na unsafe condition dito sa part na to, tapos nabigyan ng recommended controls, dapat ma-address yon kasi ang target nun is to eliminate the chance or probability na magkaroon tayo ng aksidente. Pag magkaroon ng aksidente, magkakaroon ng losses. Okay? Or even death. Injuries or diseases. Yun kasi yung hinahabol. Kaya kailangan, pag merong recommendations, ang Health and Safety Committee with regards dun sa mga unsafe acts and conditions na na-observe, dapat ma-address natin. Kasi hindi para wala lang, kundi kailangan nating ma-address yon para ma-eliminate or ma-mitigate natin yung chance or probability na magkaroon ng aksidente. Okay? Every workplace has different hazards, risks, levels of exposure. Tailor fit your OSH response to your risk classification. Sabi ko nga, iba-iba. Ang response ng OSH depende sa shape ng industry. Kung sa construction ka, i-tailor fit mo yung OSH program mo sa construction business. Pero dahil tayo nga nasa hospital settings and education, meron tayong school, ang ating OSH programs, yung response natin sa OSH is pang hospital settings and for school. Yan. Gustong-gusto ko tong team na to. Lahat tayo pwedeng maging OSH champions, okay? Hindi lang yung safety officer, hindi lang yung Osh Committee, hindi lang yung employer, no. Lahat tayo pwedeng maging OSH champions. Kasama dito ang mga employees or workers. Okay? I-involve natin yung sarili natin pagdating sa implementation ng occupational safety and health. Kasi para sa kaligtasan natin to at para sa kaligtasan ng ating mga kasama sa trabaho. Okay? Part 2 ng Module 2 is the development of an occupational safety and health program or the manual. Okay? Isa rin to sa mga requirements ng DOLE sa lahat ng mga establishments, especially yung mga high-risk classifications like us, no? Under healthcare services, classified as high-risk tayo. No? So, ang ating occupational safety and health program falls under the comprehensive type of the OSH program. Okay? Explain natin ano ba yung mga nilalaman nitong mga OSH program ito or yung Occupational Safety and Health Manual. As defined, safety and health program is a systematic plan to identify and control hazards and respond to emergencies. Okay? Ito, maliit pa lang. Napakasimple pa lang nung definition niya. Sabi niya, systematic plan to identify and control. Okay? Hanapin mo lang yung mga issues with regards to safety and health. And then, mag-recommend ka ng control to mitigate the risk. Simple lang. Identify the hazards and control the possible risk. Okay? Also, respond to emergencies. Parang tatlo lang, no? Pero titingnan natin kung tatlo nga lang ba yan, no? Yung nilalaman ng Occupational Safety and Health Program. It lays out responsibilities, resources, and procedures for keeping the workplace and safety health. Okay? So, madidiscuss din pala dito yung mga responsibilities, mga resources, and procedures for keeping the workplace health and safety. Ito na. Galing to sa comprehensive type ng Occupational Safety and Health Program. Basically, it's one of the requirements ng DOLE sa mga establishment. No? Una, lalagay mo dyan yung complete details like name of company, date established, complete address, and other informations. No? Then, yung type of business, i-check mo siya dyan. For example, tayo, nasa service, healthcare services. Ilalagay mo dyan. Then, fill out mo yung lahat ng mga hinihinging information dyan. 1.0 of Occupational Safety and Health Program. Tawag dito, company commitment to comply with OSH policy. Ito yung parang isang agreement between employer and occupational safety and health, no? Nakalagay dito, name of the company, for example, FEU NRMF, do hereby commit to comply with the requirements of Republic Act 11058 and Department of Labor and Employment, Department Order 198-18, and its implementing rules and regulations, and the applicable provisions of the Occupational Safety and Health Standards. In the first paragraph, kitang-kita mo na yung commitment ng employer dun sa compliance with the Republic Act 11058 and Department Order 198-18 and as well as the Occupational Safety and Health Standards provisions. Okay? Nakita mo na, nag-commit na dun yung employer, no? Also, sa paragraph 2, we acknowledge the company's obligation and responsibilities to provide appropriate funds for implementing this OHH program, including orientation and training. So, ito na, nabigay na sa atin yung free trainings, no? Of its employees on occupational safety and health. Ito na yun, yung pangako nandun sa commitment. Provision and dissemination of IEC materials. Those are the information, education, and communication materials, no? Kung makikita nyo, yung mga nilalagay namin na posters dyan, yung mga pinopost namin na Osh materials sa social media, and also yung education, yung pagtuturo namin ng occupational safety and health through these webinars or trainings. Okay? Provision of personal protective equipment, yung mga PPE, when necessary. Okay? Binibigyan naman tayo palagi ng employer natin, ng ating management ng personal protective equipment kung kinakailangan. Okay? And other OSH-related requirements and activities. May bonus pa. Yung healthy lifestyle program natin, supported pa rin ng ating management, no? Kaya tayo nagkakaroon ng healthy lifestyle program na ganyan, it's because sinusuportahan tayo ng ating employer, ng management. Okay? To ensure the protection for our workers and employees against injuries, illnesses, death through safe and healthy working conditions and environment. So, napaganda, no? Committed yung ating higher management for the implementation of this occupational safety and health program to protect our workers and all employees. Third paragraph, we commit to conduct risk assessment as required to prevent workplace accidents as well as comply with other provisions of this OSH program, that we are also fully aware of the penalties and sanctions for OSH violations as provided for an Republic Act 11058 and its implementing rules and regulations. So, napakaganda ng laman, no, ng statement of commitment ng ating management pagdating sa occupational safety and health. And then, yung 1.0 na to, kailangan pipirmahan siya ng ating executive or the owner of the establishment or the executive member of the establishment bilang katunayan na nagko-commit siya with this company statement of commitment to comply with the OSH policy. So now, since 2019 hanggang ngayon, palagi naman tayong sinusuportahan ng FEU NRMF management pagdating sa OSH policy implementation. Okay? Number 2, general safety and health programs. Okay? Sabi dito, kailangan pala merong risk assessment. Okay? Conduct of risk assessment. Okay? Ito yung basic example ng risk assessment form, no? Kung makikita nyo, first column, dito nyo ilalagay yung task, kung ano yung mga ginagawa. Okay? Second column, yung hazard na na-identify dun sa task na ginagawa. And then, third column, yung risk, possible risk na pwedeng mangyari with these hazards identified, no? So, tatlo na. Task, identified hazards, and then risk descriptions. Then, pang-apat na column, dito mo na i-grade yung priority level ng na-observe mong risk. Okay? Pwedeng low, medium, and high. Okay? Then, dito sa fifth column, lagi dapat merong recommended control measures. Kasi, kung na-identify mo na yung hazards dito sa task, and then, na-foreseen mo na kung ano yung possible risk na pwedeng mangyari with these identified hazards, na-rate mo na yung priority level. For example, nilagyan mo ng high level. So, priority, dapat gawin na agad yan. And then, dapat, meron ka ring ibibigay na recommended control or yung measures to mitigate, if not to eliminate the identified hazards and risks. Okay? Dito may basic example no kung paano ginagawa yung risk assessment. Alam ko under quality assurance nagkaroon tayo ng ng time na mapag-usapan kung paano ba talaga ginagawa yung risk assessment. So ganito 'yon. Basic example is ganito. Wala na kayong ibang gagawin, ganyan lang. Ilalagyan nyo lang ng laman yung table based on your observations within your workplace. Okay? Meron kasing part nitong occupational safety and health training modules. Nasa module 4 kasi yung pinaka-explanation nitong risk assessment, no? Under the module hazard identification, risk assessment and control. Doon ko ituturo kung paano ginagawa ng tama yung risk assessment. Okay? 2.2, medical surveillance. Company will require all employees, the company will require all employees to undergo a baseline or initial medical health examinations prior to assigning to a potentially hazardous activities. The examination will include but not limited to the following. Okay? Lagi naman tayo may ganito sa pre-employment process, no? Routine 1, dapat meron kang CBC, X-ray, urinalysis, and stool examination. For special set, kasama na dito yung blood chem, ECG, and others. Okay? Yung scheduling quarter 1, 2, 3, 4, no? Random drug testing, yes, ginagawa naman natin yan. And yung submission namin dito, kung ano yung list na binibigay ng ating HR department, yung list of pre-employment requirements, nakasama na kasi dito yung medical requirements. So, yun yung aming attachment dito as part of this medical surveillance. Okay? 2.3, first aid, healthcare, medicines, and equipment facilities. Okay? Lalagay dito. Tatanungin ng DOLE, how many treatment rooms or first aid rooms are existing in your own company? Sagutin mo yan. How many clinics in the workplace or what hospital or hospitals are you affiliated with it? Wala kayong clinics. Okay, 3.0 and 4.0. Health programs for the promotion and prevention and control. Okay, isa-isahin natin, no? This refers to the drug-free workplace in compliance to Republic Act 9165. That's one, drug-free workplace. Human immune deficiency syndrome, HIV or AIDS in compliance to RA 8504. That's 2. Another one is Republic Act 11166, tuberculosis in compliance to Executive Order 187-03. That's 3. And hepatitis B in compliance to DOLE Advisory Number 05 Series of 2010. That's 4. And mental health in compliance to RA 110365. 5 programs kailangan pala yung 5 programa na yan ay na-implement sa ating establishment. Ulitin ko Number 1, drug-free workplace, okay? HIV or AIDS program, and tuberculosis, anti-tuberculosis, and hepatitis B, also the mental health in compliance with RA 11036. 5 pa lang programa, health programs. And luckily, we all have those programs sa FPU, NRMF. We have written policies and programs for all of that. And that's it. Complied tayo dyan. Okay? Number 5, composition and duties of Safety and Health Committee. Ito na naman, yung Safety and Health Committee na yan. The Safety and Health Committee of the company is responsible to plan, develop, and implement OSH policies and programs. Sabi ko nga, from the Module 1, yung unang module na tinake up natin, ang aming task or job duties and responsibilities as members of the Health and Safety Committee is to plan, develop programs, and implement the occupational safety and health policies and programs. Okay? Also to monitor and evaluate the overall management and in implementation of safe and healthy policies and programs. And also to investigate all aspects of the work pertaining to the safety and health of all the workers shall be composed of the following compliance with the law. So, ito nga, hindi naman namin basta-basta kini-create lang yung structure ng Health and Safety Committee. In accordance yan, in compliance yan with the DOLE set standard ng Safety and Health Committee. Okay? Ulitin ko. For Type A, for establishments with less than 10 workers, okay. For Type A, for establishments with less than 10 workers, and yung mga low-risk establishment with 10 to 50 workers, kailangan meron siyang SO1. Okay, yung Safety Officer 1 na yan, tinake up na natin dun sa Module 1 kung ano yung mga prescribed trainings na kailangan niyang ma-achieve bago siya ma-appoint as Safety Officer 1. Okay? Pag meron na siyang Safety Officer 1, yung Type A business, kailangan niyang iset yung or mag-establish ng Osh Committee with this composition. Okay? For the chairperson o yung may-ari ng maliit na business na merong less than 10 workers or yung 10 to 50 workers pero low risk yung establishment, kailangan meron siyang chairperson o yung may-ari ng tindahan. Okay? Second, yung secretary will be the Safety Officer 1. And then member, at least 1. Pwedeng yung cashier, pwede yung crew. And then buo na yung kanyang Health and Safety Committee. That's for the low risk establishments, no? Yung mga merong less than 10 workers or 10 to 50 workers na low risk yung classification ng establishments. Okay? Hindi yan yung sa atin eh. Okay. Workplace policy and program on promoting workers' health and ensuring prevention and control of health-related issues and illness. Okay? Ito ulit yung parang yung kanina, yung statement of commitment na pipirmahan ng employer, and ito may kaibahan lang kasi may intervention ang employee representative. Okay, basahin natin. Company is committed to promote and ensure healthy and safe working environment through its various health programs for its employees. We shall conform to all the issuances and laws that guarantee workers' health and safety at all times. Napakaganda nung statement, no? Okay? The company shall ensure that workers' health is maintained through the following company programs and activities. So, ito na yung ginagawang programs ng Health and Safety Committee, no? Letter A, orientation and education of employees. That's through trainings, webinars, okay, so on. Access to reliable information on illness and hazards at work. Na-discuss na natin yan sa Module 1. Referral to medical experts for diagnosis and management of illness and health-related concerns. Meron tayo yan, referral programs. Provide health-related programs such proper nutrition and exercise activities are made available to the workers. Yes, we do have this healthy lifestyle program. Then the above-mentioned program shall comply with the government issuances on promoting healthy lifestyle, addressing mental health in the workplace, and preventing and controlling substance abuse. Okay. In addition, company policies to protect workers' rights arising from the illness shall be guaranteed. The company shall promote the following workers' rights: confidentiality and information, non-discrimination, including non-termination, work accommodation following a course of illness, assistance to compensation. So lahat yan, nagko-commit ang ating employer, yung ating management, and kasama magko-conform ang employees representative. This policy is formulated for everybody's information. The company is committed to ensuring workers' health and providing healthy and safe workplace, signed by the owner and one from the employee representatives. Okay? Tuloy natin yung type of occupational safety and health committee, no? Naligaw yata yung isang page na yon. Pero anyway, kanina yung type A for less than 10 workers and low risk establishments. For this one, type B for medium to high risk establishments. So nandito na tayo, no? With 10 to 50 workers and low to high risk establishments with 51 workers and above. The OSH committee of the covered workplace shall be composed of the following. Okay? Wala yung... Okay, gamitin natin to, no? Katulad din sa Joint Coordinating Committee. For chairperson, kailangan din yung may-ari ng establishments or any executive member. For secretary, ganun din. Ang safety officer ng workplace will be the secretary of the committee. And dun sa members, meron lang kaibahan, no? For members, dapat meron kang 2 safety officers from the building and selected Joint Osh Committee and 2 representatives of workers from which one must be from the union member if organized. Okay? So, yun. Nandun yung ating framework ng Safety and Health Committee pagdating doon sa Type B and doon sa Type C or kung tawagin is Joint Coordinating Committee. Yun lang yun. Magkamukha lang yung Type B and Type C. Kaya lang, sa Type C kasi, kaya tinawag na Joint Coordinating Committee. For example, nasa isang building ka lang, no? Pero, ang nag-house na establishments sa isang building is, let's say, 4 to 5. Ganon. So, ito yung type of Osh Committee na kailangan nilang i-establish. Okay? All members of the Health and Safety Committee shall perform their duties and responsibilities by the OSH law and its implementing guidelines. Okay, Safety and Health Committee minutes, reports submitted to DOLE. Please see attached latest OSH Committee minutes. Yan. Yan yung sinasubmit namin sa DOLE. Pero quarterly kasi yung submission yan. Nung minutes of the meeting ng Health and Safety Committee. 6.0, Personnel and Facilities ng Occupational Safety and Health. Okay? Ito, hinihingi rin sa OSH program. Sa 6.1, yung safety officer details, no? Kung meron kayo ditong 3 safety officers, ilalagay mo yung mga pangalan nila dyan. And what are the trainings na meron sila as prescribed by the Department of Labor and Employment. And sa 6.2, Emergency Occupational Health Personnel and Facilities. Dito na makikita yung mga occupational health nurse, occupational health physician, occupational health dentist, and a certified first aider. Okay? Also, yung occupational health facilities, dito rin namin inilalagay kung ilang beds meron tayo, kung ilang medical clinics, and others. 7.0 ng Occupational Safety and Health Program is the safety and health promotion, training, and education provided to workers. Pang employees to and pang workers, no? First, yung orientation of all workers on occupational safety and health. Ito na yon. Yung kinukuha natin ngayon or yung pinag-aaralan natin ngayon, yung mandatory 8-hour occupational safety and health trainings for employees, conduct of risk assessment, evaluation and control, ginagawa natin yan. Pero mas mainam sana, no, na lahat tayo ay gumagawa ng risk assessment. Tulong-tulong tayo mag-assess ng ating facilities or ng ating work environment, no? Continuing training on occupational safety and health for OSH personnel. Para sa amin to. Para sa safety officer, sa physician, sa health nurse, sa dentist, and sa certified first aider. Kailangan tuloy-tuloy yung pag-training namin for improvement, no? Work permitting system, meron tayo nito as part of the facility management policy. Lahat ng work to be done sa facilities kailangan is supported by work permit. Okay? Applicable for medium and high risk establishments. Yun nga. High risk establishment tayo. So, ina-apply namin tong work permitting system. And we have this policy na pag sa mga outsource or mga third-party suppliers or contractors, pag walang work permit, walang trabaho. Ganun lang yan. Okay? Dito, ilalagay din namin. Maikli lang yung rows nito, pero kailangan maipakita namin kung anong OSH training ang na-conduct namin for employees. Okay? As well as the attendance and the date they attended. Okay? Hinihingi din yung risk assessment result, no? Yung tawag namin dito, risk registry. These are the compilation of our risk assessment based on our risk registry for year. No? So, ina-attach ko yun dito palagi. Medyo mahaba to, kaya attachment na lang. Okay? Conduct of toolbox meetings, safety meetings, if applicable. Yun na nga. Okay, for item number 9, accident or incident or injury investigation, recording, and reporting. So, ano ba namin to ginagawa? Sahin natin. Any dangerous occurrence, major accident resulting to death or permanent total disability shall be reported by the company to the Department of Labor and Employment Regional Office within 24 hours from occurrence using the prescribed form, yung WAIR, yung work accident or incident notification. Linaw, our employer or the employer shall submit WAIR pag merong dangerous occurrences, no? Mga major accidents resulting to death or permanent total disabilities. So, kailangan sa loob ng 24 na oras, na-notify mo na yung DOLE na merong nangyaring aksidente resulting to permanent disability or disabling injuries or death. Okay? After the conduct of investigation, the company shall prepare and submit work accident report using the prescribed form, yung WAIR. Moreover, other work accident resulting to disabling injuries such as permanent partial disability and temporary total disability shall be reported to the DOLE Regional Office within 30 days. Yung mga minor incidents lang naman na yun. Monthly lang. Monthly lang yung submission. Pero yung mga major accidents like yung fatal accident na resulting to death and permanent disability, kailangan within 24 hours, na-submit mo na yung notifications ng accident sa regional office. Pero yung mga temporary disabilities na accident, monthly yung submission namin ito sa Department of Labor and Employment. Okay? All near misses shall be recorded and reported. So, a system for notification and reporting of work accident, including near misses within the company, shall be developed and reviewed by the OSH committees as necessary. Okay? Currently, ang submission namin ng mga near misses incidents ay through portal, no? Meron kaming ERS account which was provided by the Department of Labor and Employment dahil kasi hindi kami nakakapunta sa regional office ng face-to-face because of the restrictions of the IATF dun sa mga face-to-face, no? So, ang submission namin ng reports ngayon is mostly online using the ERS account ng FEU, NRMF, provided nga ng DOLE. Okay? Usually, attachment yung nilalagay namin dito. 10.0, provision and use of PPE. Dito sa 10.0, simple lang sana to eh. Sabi dito, issuance of PPE shall be supplemented by training on the application, use, handling, cleaning, and maintenance. Kailangan lang namin ipakita dito kung paano ba yung distribution ng PPE or kung nabibigyan ba sila ng proper education on how to use, how to handle, paano linisan, and paano yung maintenance ng mga issued personal protective equipment. Madali lang sana to eh. Kukunin lang sana namin sa mga departments or kung sino man ang responsible for the issuance of personal protective equipment, hihingi lang kami ng records kung ilan ba yung nabigyan, ilang workers yung nabigyan ng personal protective equipments. For example, N95 mask, nabigyan natin is 1,000 employees for this year. Ganun lang sana eh. Medyo nagkakaroon lang tayo ng problem sa yung submission. Okay? Pag nagpalipad kami ng request na nag-request kami ng records of issuance ng personal protective equipment and yeah, some of them nagbibigay and meron din mga hindi. So, yun yung nagiging butas namin or yun yung mga nagiging lacking namin dun sa report submission, no? Siyempre, pag hindi nyo kami binigyan ng records to support this 10.0 or yung justification for the provision and use of PPE, saan kami kukuha nun? Hindi ko naman kayang mag-create or mag-produce ng ganong klaseng records kasi nasa inyo yon, nasa inyo yung distribution. What I'm asking lang is a copy of your records to support this 10.0 provision. Okay? So, ganun. Okay, 11.0, safety signages. Safety signages include warning to workers and employees and the public about the hazards within the workplace. Sabi nga, warning signs, kailangan natin yan. Paano namin to sinasubmit? Yung lahat ng ini-issue namin na safety signages to give warning sa mga employees and workers, pipicturean lang namin yon. Then, yun yung attachment namin for this, yung 11.0. Okay? 12.0, dust control and management and regulation on activities such as building of temporary structures and lifting and operation of electrical, mechanical, communication system, and other requirements. Applicable for medium to high risk with 10 to 50 workers as low as, and low to high risk establishments with 51 workers and above. Okay, 12.0, yung dust control and management na to. Usually, yung application nito is dun sa mga third-party services natin like construction projects, no? Dito, humihingi kami ng dust control management, yung pinakamadaling example, no? Pag meron isang part ng hospital under renovation, di ba? Kailangan mayroon siyang board up or yung enclosure to isolate yung work area dun sa operational areas ng hospital. So, dust control management, specifically, pag merong mga drilling works, pag merong mga excavation, kailangan meron silang dust control and management. And naibibigay naman, nakukomply naman nila to with the use of their exhaust systems. Meron silang yung mahabang exhaust system, ay yung parang exhaust fan na mahaba para hihigupin yung alikabok sa loob and then ibabato dun sa labas na walang maapektuhan, yung walang tao. Kaya pakita lang namin dito yung picture tsaka yung deployment nung dust control and management sa loob ng construction. Ito, parang sort of list sa facilities na provided for workers. Yes or no lang. Pero tayo, we all have this, no? A, adequate supply of drinking water. Yes. Adequate sanitary and washing facilities. Yes. Suitable living accommodation. Yes. Separate sanitary washing and sleeping facilities. Yes. Lactation station. Yes. Ramps, railings, and the likes. Yes. Other workers' welfare facilities as prescribed by OSHS and other related issuances. Yes. Like yung provision ng transportation services tsaka yung mga food packs for employees. No? 14.0. Sorry. 14.0, Emergency and Disaster Preparedness. Ito yung mga laman, no? 14.1, Written Emergency and Disaster Program. Yes. 14.2, Types and Number of Drills Conducted. Okay? So, ilalagay namin dyan kung kailan kami nag-conduct ng drill or evacuation. And then, supported with some evidences like attendance or photos ng actual training or drills. 15.0, Solid Waste Management System. The Written Pollution Control Program. Yes. Name of Pollution Control Officer. Yes, nilalagay namin dyan yung ating PCO. Then 16.0 or the compliance with reportorial government requirements. Okay? Ito na nga yung sinasabi natin na WARMA, no? Yung Work Accident or Illness Report. That's one. The Annual Exposure Data Report, the AEDR. And we also have the Safety and Health Organization Report and the Annual Medical Record Report and the Occupational Safety and Health Program. Okay? Okay, 17.0, the Occupational Safety and Health Program, the Control and Management of Hazards. Sabi nga, yung conduct of HIRAC lang, no? Kaya importante lahat tayo marunong gumawa ng risk assessment, no? Kasi kung hindi tayo marunong gumawa ng risk assessment sa ating sariling work environment, hindi tayo makakapag-identify o hindi tayo makakapag-submit ng recommended controls to eliminate those yung hazard sa paligid nyo kung hindi nyo magagawa yung risk assessment. Okay, 18.0, Prohibited Acts and Penalties, Sanctions for Violations on OSH. Okay, yung simple lang to, nagki-create lang kami ng ng penalties for violations of Occupational Safety and Health Program implementation, sorry. And isasubmit lang namin to sa management para ma-incorporate doon sa Code of Discipline kasi sabi nga dito sa Occupational Safety and Health Program, dapat meron kang prohibited acts and penalties or sanctions for the violations on OSH. Kailangan incorporated siya dun sa Code of Discipline for everybody. Okay? Ito yung example, no? We're not using PPE. First offense is warning. Second offense, 3 days suspension. Third offense, 5 days suspension. Ganun lang yun. Littering and loitering, smoking in prohibited areas, illegal dismantling of safety signages and paraphernalia, not following safety rules. Meron tayo niyan. Pero sa ngayon kasi, a separate policy pa siya kasi hindi pa siya kasama dun sa Code of Discipline ng FEU NRMF. 19.0, okay, Cost of Implementing Company OSH Program. Okay, this is applicable for medium to high risk establishments with 10 to 50 workers and low to high risk establishments with 51 workers and above. So, pasok tayo dito. Ganito lang yon. Same with the penalties and violations for the Occupational Safety and Health. Ito rin, meron ding separate policy to, no? Sa Cost of Implementing Company OSH program. So, ngayon, yes, merong amount per year. May allotment ng ganitong amount para sa Occupational Safety and Health program implementation, no? Nakalagay kasi dito, annual estimated amount for OSH program implementation to include but not limited to the following: orientation and training, safety officer, OH personnel, purchase of maintenance or PPE, first aid medicine, and other medical supplies, safety signages and devices, fire safety equipments, tools, safety of equipment, or for example, machine guards or etc. Ganun yon. For example lang ha, yung lahat ng nabanggit na yan, yes, meron kaming budget annually, meron kaming allotment in a separate pay, no? For example, 1 million per annum. Yung 1 million na yon dapat spend namin yon with all this. Sabi nga, for orientation or trainings, safety officer, OH personnel, purchase ng mga maintenance or maintenance of PPE, first aid medicines and other medical supplies, safety signages, devices, fire safety equipments or tools, safety of equipments, and machine guarding. So, doon namin yun ginagamit. Yung kunya halimbawa, meron kaming allotment ng 1 million per annum, igagastusin namin yon doon sa mga items na nabanggit. Okay? And nasa separate policy pa siya ngayon under Occupational Safety and Health. Alright. These are the summary of administrative and reportorial requirements. No? Ilagay na naman sa sa acronym para meron kaming palatandaan. Medyo marami kasi, no? N for notification and keeping of records of accidents and or occupational illnesses under Rule 1050. Okay? O for occupational health service under Rule 1960. Okay? Registration of business, Rule 1020. Training of personnel in OSH, Rule 1030. Health and Safety Committee, Rule 1040. Occupational Safety and Health Program. And the other acronym for WARMA is W for Work Accident or Illness Report, and to be submitted every 20th day of the following month. A for Annual Work Accident or Injury Exposure Data Report, yung AEDR, to be submitted every January 30 of the year. R for Report of Safety Organization, annually din yan. Minutes of Osh Committee meeting, quarterly submission. And A for Annual Medical Report, to be submitted every March, 30th of March. Okay? Section 29. Ito naman, hindi na to galing sa Osh program ng establishments, no? This is one the section from the Republic Act 11058, and it's IRR, which was implemented January 2019. Prohibited acts and its corresponding penalties. Kalagay dito, any willful failure or refusal of an employer, contractor, or subcontractor to comply with the following OSH standards below, or with a compliance order issued by the Secretary of Labor and Employment or his or her authorized representative, shall be penalized of the administrative fines as follows, computed on a paid per day basis until full compliance. So, may notes dito na ang computation nito, yung corresponding penalties, ang computation yan is per day until such time na makomply mo yung issue to be corrected. Okay? Banggitin ko lang, no, para at least may idea ang lahat kung paano ang monetary computation do sa penalties ng OSH from the Republic Act 11058. Okay? First, yung registration of establishments to DOLE, failure to have that, 20,000 per day. Provision of job safety instructions or orientation prior to work. Pag napatunayan na hindi natin to ginagawa or hindi ginagawa ng employer, that's 20,000 per day. Provision of workers training. First aid, mandatory workers training, mandatory OSH training for safety officers and health personnel. Okay, that's 25,000 per day. Okay? Provision of safety signage and devices, 30,000 per day. Provision of medical supplies, equipment, and facilities, that's 30,000 per day. and submission of reportorial requirements as prescribed by the Occupational Safety and Health Standards, also 30,000, that's per day computation. Provision of safety officers and or occupational health personnel, 40,000 per day. Okay? Provisions of certified personnel or professional required by the OSH standards, 40,000 per day. Establishment of a safety and health committee. Kung wala niyan, penalty of 40,000 per day. Formulation and implementation of a comprehensive safety and health program. That's 40,000 per day. Provisions of information on hazards and risks, yung absence of chemical safety data sheet, no written SOP in machine handling, lifting, etc. No permitting system for confined spaces, hot works, no lockout tagout system, 40,000 per day. Provision of sanitary and welfare facilities, that's 40,000 per day. Use of approved or certified devices and equipment for the task, 50,000 per day. Provision of PPE or charging of provided PPE for workers, 50,000 pag napatunayan, no? Compliance with the Department of Labor and Employment issued for work stoppage order, 50,000. Compliance to other Osh standards, 40,000 per day. So, yun po, yung computation ng penalties for violations ng Osh standards. Prohibited acts and its corresponding penalties. Ito po yung paliwanag. No? If any of the following act is present and there is non-compliance, the penalty of 100,000 pesos administrative fine shall be imposed separate and in addition to the daily administrative fine imposed above. So, kung nakita natin dito, for example lang nakadalawang violation tayo. For example, this registration of establishment and yung provision of job safety instruction or orientation prior to work. That's a total of 40,000 per day. Kasi 20,000 plus 20,000 per day, 40,000 per day. And an additional 100,000 administrative fine. So, patong pa pala to dun sa daily computed penalty. Another 100,000 administrative fine shall be imposed separate in addition to the daily administrative fine imposed above. Okay. Repeated obstruction, delay, or refusal to provide the Secretary of Labor and Employment or any of its authorized representatives access to the covered workplace or refusal to allow access to relevant records and documents necessary in determining compliance with OSH standards. Okay? Yung sabi ko nga, dun sa visitorial powers ng Secretary of Labor and Employment, hindi dapat natin sila pipigilan pag gusto nilang mag-visit to verify everything sa compliance ng occupational safety and health whenever may mga tao or may operation yung establishment. Once na dumating yan, meron silang mission order, kailangan papasukin natin yan. Or unless, otherwise, mabibigyan tayo ng additional administrative fine na worth 100,000 pesos. Okay, misinterpretation in relation to adherence to occupational safety and health. Yung mga maling interpretations natin dun sa sinusunod natin na rule, mali naman pala. Misinterpreted naman yung yung pagkakaintindi dun sa rule. So, yun, yung mga factor na pwedeng gamitin sa atin para mabigyan tayo ng administrative fine. Making retaliatory measures such as termination of employment, refusal to pay, reducing wages, and benefits, or in any manner discriminates against any worker who has given information relative to the inspection being conducted. So, yun. Pag napatunayan na may retaliation acts versus dun sa employee, nagbigay ng information relative to the inspection, grounds din yon para mabigyan ka ng another 100,000 pesos administrative fine sa part ng employer. Okay, when the violation exposes the worker to death, serious injury, or serious illnesses, the imposable penalty shall be 100,000 pesos. Yun, yung sa may imminent danger, no? Should there be 2 or more non-compliances, all penalties shall be imposed, provided that the total daily penalty shall not exceed 100,000 pesos. Ayun naman pala. Kung halimbawa, 10 yung naging violation mo out of these penalties. Halimbawa, 10 yung violations mo dyan and nag-total ka ng 150,000 per day. Sabi ng DOLE, ima-maximum lang na 100,000 pesos per day kahit na marami ka pang violations. Yun na yung maximum na ina-allow nila na penalties. For example, ang total violation ko nga is as computed in a daily basis is 150,000. So magiging 100,000 na lang yun per day. Tawad na daw yung iba. Okay, the penalty shall be computed on a per day basis until full compliance reckoned from the date of the notice of violation or service of the compliance order to the employer without prejudice to the filing of a criminal or civil case in a regular court, as the case may be. Fines herein imposed shall be without prejudice to the fines imposable by other appropriate government agencies. So, iba naman yun. Walang kinalaman yung sa administrative fines ng OSH. Okay? The regional director shall, after due notice and hearing, impose the appropriate administrative fines, taking into consideration the damage or injury caused and risks involved, including the severity and frequency of the OSH violations and size of the establishment. Okay? Yung regional director yon dun sa regional office. Siya yung mag-i-issue ng notice and hearing. Fines collected pursuant to this rule shall be utilized for the operation of occupational safety and health initiatives, incentivizing qualified employers and workers in recognition of their efforts towards ensuring compliance with OSH and general labor standards, including OSH trainings and education as well as intergovernmental programs and activities. So, dun pala napupunta yon yung mga pera na iipon from the penalties and violations, ginagamit pala ng OSH para dun sa incentivizing, yung sabi nga sa incentive sa section ng ating OSH, giving incentives to employers or employees for complying with occupational safety and health standards. So, minsan nagbibigay sila ng free training packages, mga libreng PPEs, mga reading materials, and iba pa. Doon pala napupunta yan. Okay, enforcement is one response, but not the only response. Okay. Once again, lahat po tayo pwedeng maging OSH champions. Tulong-tulong tayo dito sa ating workplace. Okay? Thank you very much and keep safe. See you on the next module. Bye.